Hello and welcome, everyone. My name is John Rickard, the Education and Communication Specialist with the Rural Health Transformation Center. Thank you to those who participated in our test poll. We will have other polls pop up throughout the webinar and appreciate your participation. Additionally, feel free to enter questions into the Q&A pod accessible via the control bar on your screen. We will leave some time at the end to answer questions. This is the 7th webinar in our series From Sticking Point to Tipping Point, Overcoming Rural Community Health Improvement Challenges. The previous 6 webinars are available for viewing on our website, as will be the recording of this webinar. A link to our website has just been posted to the chat. You will also be receiving the link to this recording via a follow-up email. Now, on to the main event, social marketing for community health transformation. Today we will be discussing how to accelerate a culture of health within a community by using social marketing strategies. Additionally, we will give an overview of how to layer evidence-based interventions, physical environment enhancements, and policy changes with strategic social marketing campaigns to successfully drive lifestyle behavior change among residents. Here to share some expertise on the matter is Cindy Winters, the project advisor for the Rural Health Transformation Center. Cindy, the floor is yours.
Thanks, John, and thanks everybody for joining us for this today. For the next 30 minutes, we're going to share some of our social marketing for transformation experiences with the Heart in New Ulm project. We'll share some of our recommendations that have come about as a result of the 10 years of experience working on rural community health and measuring the impact. We've applied multiple behavioral and social learning theories and models as we've done this work. But what we'll share today is less about the formal theory and more about what we found helpful to advance our work and what we've learned from applying the theory in a real world setting to have the most impact. We'll share our lessons learned, both good and bad, as well as the process that's worked for us. During the webinar, we hope you discovered the value of penetrating a community with consistently tailored messages and how to use what we've shared to propel your efforts. At the end of the webinar, you'll be able to download a worksheet that contains all the steps we've used in our work, which we hope will help you identify key areas so that you can use these to accelerate your efforts to have more of an impact. And I just want to read to you what the definition of community-based social marketing is from Doug Mackenzie Moore, who has written the book Fostering Sustainable Behaviors. So community-based social marketing approach carefully selects the behavior to be promoted, identifies the barriers and benefits associated with the selected behavior, designs a strategy that utilizes behavior change tools to address these barriers and benefits, and then pilots the strategy with a small segment of a community, and finally evaluating the impact of the program once it's been broadly implemented. So these lessons that I'm going to share today have come from our groundwork, our on-the-ground experience with the Heart in New Ulm project, a 10-year research demonstration project in New Ulm, Minnesota, to decrease heart attacks in the 56073 zip code. New Ulm is a small rural community of about 13,500 people located 90 miles southwest of the Twin Cities. The project began in 2009 and the research portion officially ended in 2018. However, the project is still going strong as a fully owned and community-driven community health improvement initiative that's being led by an umbrella community leadership team and several action teams addressing specific challenges. One of which is getting people to be more physically active and using walking and biking as a form of transportation rather than just recreation or exercise. The Heart in New Ulm project was designed to apply and widely disseminate established evidence-informed health improvement practices based on the community's own level of risk and customized to their preferences. To set strategy, we first had to understand the community needs. When the project started in 2009, we conducted community screenings to better understand the health and health behaviors of our target population of 40 to 79-year-olds. The community diagnosis told us that 76% were either overweight or obese. 38% had metabolic syndrome, which puts people at risk for at high risk for coronary heart disease and or diabetes, which is about 10% higher than the national average. 17% reported getting the recommended amount of 5 or more fruits and vegetables of servings a day, and 64% getting the recommended amount of 30 minutes of physical activity per day. These findings form the basis for decisions about how we set our priorities going forward and started to distill the basis for our messaging. The city of New Ulm has a great network of sidewalks throughout the majority of the city, so many residents walked for exercise and recreation, but there was very little bike infrastructure other than a circular trail around the city that wasn't fully marked. So residents also weren't walking or biking for transportation. We focus on the 40 to 79-year-old age range because this is the age range that was most likely to experience a heart attack during the project's 10-year timeframe. Our long-term goal was to reduce the number of heart attacks over the course of the project by addressing the 9 modifiable risk factors listed on this slide. Because 90% of heart attacks are attributed to these risk factors. Small changes in several risk factors can lead to major improvements in health at the population level. We use the social ecological model, which is a prevention framework that considers the complex influences on overall health to determine where and what evidence-informed strategies to implement. Reaching people in the various locations where they live, work, learn, and play. All the way from an individual level, which reaches a small number of individuals, to the policy level that reaches the majority of residents in a work site, neighborhood, or community. We layered a consistent communication strategy with the various interventions to help motivate and to minimize confusion by providing clarity. By providing these 2 things, you're solving problems for your audience: lack of motivation and lack of clarity. Providing that value will help to increase engagement. Heart in New Ulm project markets a way of life with messages that penetrate the entire community, helping propel a shift to a culture where health is the new norm. Creating a culture change to improve residents' health is a marathon and not a sprint. A comprehensive long-term communication strategy is necessary to infiltrate the community. Our goal was to ensure that our brand and messages were being seen throughout the community where people lived, worked, played, and sought health care, etc. It's important to think about the partnerships and relationships you need to develop in order to leverage what's happening across the community. These partnerships are going to look different in every community, but these are the relationships that we were able to develop over the course of the project. So we partnered with a local cable access TV channel, radio shows during their free community happening spotlights, or asking our partners, such as the schools, public health, or the recreation department, to share some of our work during their weekly radio interviews. We worked with the local newspaper. We paid for ads with grant money and then asked for opportunities to write articles, editorials, or news releases for the paper. Understand where your community receives messages. Billboards were a popular marketing communications channel for our project and very reasonably priced. The billboards were often up longer than 1 month that we paid for because the space just hadn't been rented yet. But since the project started, I think other organizations have figured out what a value that is, and now it's harder to get the billboards we really want, and the messages generally only stay up for a month or so because they've become so popular that they get rented right away. So the Heart in New Ulm project started out heavily being program focused in the beginning to engage the community in our efforts to improve community health. At the same time, we would layer communications messages to help drive motivation and action. We also used the communication messages to create community support for policy systems and environmental change. You will see an example of this as we share one of the social marketing campaigns we conducted as part of our Safe Routes to School program. But now we have some poll questions for you so we better understand where you are in the process of adopting and implementing social marketing campaigns. So the first question that you're going to see is, how have you incorporated social marketing strategies into your community health improvement work? Have you incorporated social marketing strategies into your community health improvement work? Yes, no, not yet, but planning on it. Oh, good. 69% of you said that you have. 14% said no, and 17% that said that you're planning on it, but you haven't started yet. So the second question that we have is, we've used social marketing messages in our community health improvement work to A, increase awareness, B, increase knowledge, C, to encourage behavior change in support of a particular programming effort, D, to bring attention to the need for policy systems and environmental changes within the community, or E, all of the above, or none of the above. Okay, you're pretty well split. So 41% that you've done all of them, and then 29% have used them to increase awareness, 24% to increase knowledge, and 6% have done none of the above so far. And our last question is, research and evaluation together form the very cornerstone of the social marketing process. True, false, or you're not sure? And the results are true. You guys are good. 68% said true. It is true that research and evaluation are really key to having a successful social marketing process. So now we're going to talk about consistent branding. So think about your overall brand. Is it consistent? Do people know it if they see it? We built our brand, both the look and the feel, with the community. We were so effective in building our brand awareness that when we did try to modify the brand, the look and feel, with different initiatives, it completely failed. Our residents said, nope, keep it under the Heart of New Ulm brand. So consequently, all of our communications campaigns had the same look and feel as our Heart of New Ulm logo and branding. The social marketing campaign we conducted for the Safe Routes to School program was called See Safe Smart, and the logo we created for the program used the same heart and branding colors as our project logo. We had a couple of different logos designed for the campaign, and we let the Safe Routes to School action team choose which one they wanted to use. The one above was chosen because it best represented what we were trying to accomplish. Another important step in the process is to identify your target audience. For our See Safe Smart campaign, our target audience were the parents of the children that attended the 3 different schools in New Ulm. This was a shift from our traditional target audience of 40 to 79-year-olds. About 4 years into the Heart of New Ulm project, the community began to ask us what we were doing for the children of the community. Well, children don't necessarily have heart attacks, but since we had begun making the shift to policy systems and environmental change work, we decided to incorporate a Safe Routes to School program. And that's why we identified the parents of these students as our target audience. The Safe Routes to School program has evidence-based strategies to improve the environment to make the streets safer so children are more likely to walk or bike to school. While those changes also made the streets safer for our older target audience, so they would be more likely to walk or bike for transportation and/or recreation. So we were getting their recommended amount of daily physical activity. It just made sense for us to switch gears a little bit and listen to the community to keep them engaged, as long as it also met the needs of our target audience. And that leads me into the step of listening. Listen to your partners and the residents. In 10 years, we've used the following methods to gather target audience feedback. We've conducted formal focus groups where we've advertised, screened interested individuals using a specific criteria, provided incentives such as gift cards and/or meals. We've also conducted informal interviews. We've conducted resident surveys, and for the Safe Routes to School program, we've conducted parent surveys. We've done community gatherings where we've asked questions and had informal conversations. And we've informally put up messages and materials in front of families and friends and family members that fit our target audience criteria. Just as we did for the entire community, we needed to understand the behaviors related to walking and biking to school. What's nice about the Safe Routes to School program is there are tools that have been developed to collect this information, so you don't have to come up with the tools yourself. We use classroom tallies to determine the percentage of children that were walking or biking to school. We know that 37% of the children in live within a mile of their school, and a mile takes about 20 minutes to walk. So it isn't unreasonable to expect that the percentages could be much higher. The baseline data showed that only 9% of children walked or biked to school, while 16% walked or biked home from school. So we have a long ways to go. And it's not enough just to tell someone to change a behavior, even when they're motivated to make a change. There are many outside influences that affect why people or why someone does or doesn't choose to engage in a healthy behavior. And we learned from parent surveys that they didn't allow their children to walk or bike to school because of the barriers above. The speed of traffic, the amount of traffic, which the parents were attributing to by dropping and picking their kids up at school, and uncontrolled intersections, which are numerous in UAM. We have very few controlled intersections with either stop signs or yield signs. Nearly 50% of the parents said that they would allow their children to walk or bike to school if we were able to address these barriers. So that's what we've been working towards. So we developed the See Safe Smart campaign to promote healthy driving, walking, or biking behaviors. See Safe Smart ended up being an 11-month campaign with one message promoted each month. The Safe Routes to School team looked at similar campaigns and chose one that we felt could be readily adapted to our needs and was a good fit for UAM. When we were adapting the campaign, these were the questions we asked the Safe Routes to School team. The most important step in this process is to ask open-ended questions and listen. When you receive the link to the recording of this webinar, there will also be a link to a worksheet we put together with these steps that we've created in creating our social marketing campaigns that you're free to use when you design your own campaigns. Each monthly message was a behavior the team had seen and or heard discussed repeatedly as challenges for safe walking and biking conditions. We started with a long laundry list of challenges and pared it down to 10 simple messages. UAM has 2 private schools and 1 public school, as well as a small private college in town. All of the schools participated in the campaign. It was important to get all the schools involved and garner their support. In the past, the schools haven't always worked cooperatively together, so it was important that the community knew all of the schools were involved in the campaign. This photograph has representatives from all the schools, and the picture was taken on the campus of the college near a problematic intersection. We worked with the school administrators from each of the schools to identify role models from their schools that either walked or biked to school on a regular basis. We also chose problem locations that had been identified in the parent surveys or from our informal conversations with parents and residents about places they felt less safe walking and biking. Those locations became the background for each of our messages. The messages supported the needed change at that particular location whenever possible. In this particular message, the family is one that's well known in the community and attends a public school. The gentleman in the light blue shirt in back is a physician at the New Ulm Medical Center and grew up in New Ulm. The police officer is a school resource officer. The location is in front of the new public high school in town. The street in the picture is a busy street with a stretch of several blocks with no traffic calming devices such as stop signs or signals, so cars were often going above the 30-mile-per-hour speed limit. Students had to cross the street, in other words, play Frogger, in order to walk to school. So our message here was to save lives and not seconds. Please slow down for us. We worked with a photographer to set the photo up to support the message as best we could. This photo has two students from one of the private schools that often bike to school, as well as two residents that are often seen walking or biking around town. The photo has part of the bike share sign visible on the street as well. People are often seen riding their bikes the wrong direction on the street, even with the share indicating the direction they should ride. Each month, we wrote an article for the lifestyle section of the Sunday newspaper about the need for the message and provided some data to support the message. Or we used a personal story about why the message was chosen. We used quotes from well-known residents about why they supported the message. Because location is important in messaging, this photo was taken outside of one of the public schools. Each monthly message was distributed in a variety of ways. We had a billboard, large posters that were distributed to all of the schools and public facilities that were used by a large number of residents, such as the Recreation Center, Community Center, and Civic Center. Smaller letter-sized flyers were distributed to businesses, organizations, restaurants, grocery stores, etc. around town. The police department helped distribute the flyers in the downtown area when they were monitoring the parking lots downtown. We sent the message to the local cable access channel to share between their shows. We placed the message on what the cable companies call their wall. And our partners talked about the message during their monthly radio interviews. One of our lessons learned was the message on the whiteboard used in the flyers we created wasn't easily read when used on a billboard. So we had to change up how we designed the billboards. So the message was made much larger so it was easily read by driving by, and the smaller whiteboard contained the See Safe Smart campaign logo. This message is particularly unique to New Ulm. There is a belief in New Ulm by longtime residents that if you're traveling on a north-south street, that you have the right-of-way at uncontrolled intersections, whether or not you're to the right or not. Visitors and new residents have been heard commenting on this repeatedly when they come to town. So the photo is supposed to depict the need to yield to the right at an intersection that is uncontrolled. This particular intersection is located next to a popular park located in the middle of town. One of the private schools is located on the other side of the park. I have heard more than one police officer share a story about stopping people for failure to yield to the right, and the officer and the offender has argued with the officer that the state law doesn't apply in New Ulm. New Ulm has its own law about who has the right of way. Needless to say, that's not true, but it's been a difficult concept to change. This particular location is a crosswalk across a busy street just a block from the Recreation Center, the County Health Department, a public school, and the private elementary school. Walkers, bikers, and drivers avoid this intersection during school drop-off and pickup because it doesn't function well and is difficult to get across. Vehicles rarely yield to the pedestrians trying to cross. The city engineer said this intersection doesn't warrant a stop sign on the cross street, and it's at the bottom of a rather steep hill that would make it difficult to stop in the winter during snowy and icy weather. The suggested fix for this location is a roundabout, but that's a big dollar investment that's going to require federal and state assistance to implement. But bringing attention to this particular location has helped begin conversations on the need for the change at this intersection. You'll also note that it was raining in this photo. It was actually kind of a monsoon at different times during this photo shoot. We debated whether to go ahead with the photo shoot or not, but some kids have to walk to school regardless of the weather conditions, so we went ahead with the shoot. The models in this photo are from the private schools, and the adult is the principal of the public elementary school. This particular message and location is the intersection where one of the private schools places their student crossing guards. It's 5th North Street, and it's the main street to the hospital from the highway through town. An average of nearly 4,000 vehicles per day travel past this location. A pedestrian was struck and killed 1 block from this location in 2014. The children in the photo are some of the student crossing guards from the school, and the family in the photo attend the private school. The gentleman in the striped shirt is a pediatrician at the medical center located just down the street. The Safe Routes to School team has been working with the city to find an appropriate solution to calm traffic along the stretch of the street for a couple of years so it's safe for children to walk to school. On the far side of the school is also the popular neighborhood park that was just shown in the previous slide. People living on the other side of North 5th Street across from the school have often stated how difficult it is to cross the street throughout this day when trying to get to the park or just to take a walk in the neighborhood. The city has agreed to install curb extensions at this intersection when the street's reconstructed, which is supposed to happen in the next couple years. This message and photo talks about the importance of wearing helmets when biking in Yuam. It's very commonplace to see kids riding bikes around town without helmets. The Yuam Police Department and the Yuam Medical Center have given away free helmets to families that need them for the past several years. So there's no reason that a child should not have a bike helmet in the community. But the main reason I'm showing you this message is to point out a mistake in the photo that the Safe Routes to School team never noticed until someone asked me, why is the adult in the photo not wearing a helmet? When we staged the photo, the adult was not riding a bike. It was only the children that were riding, so we didn't think about having the adult put on a helmet. But you can't tell that in the photo. We didn't set this photo up very well to show the adult as a good role model. When doing these kinds of campaigns, it's very important to consider what the message really is and what you're trying to convey correctly in the photo. A lesson learned on our part. As a recap, these are the questions you should ask when testing or determining your messaging. As you can see, we didn't do a very good job of asking what does a visual imply to you with the last slide I shared. These questions, as well as other important questions, are included on the worksheet that you'll be able to download once you receive the link to this archived webinar. And here's my contact information and the links to our website, Twitter, and LinkedIn accounts if you have any questions or want to learn more about the Rural Health Transformation Center and the services we provide. All of the previous webinars are archived on our website as well. Now I believe we might have a minute for questions and answers. So John, are there any in the queue?
Yeah, it looks like we have a few questions, and thank you to those who submitted questions. The first question is, with your work in using social marketing to change behavior, have you seen an increase in the number of children that walk or bike to school?
So that's a great question, and we've not seen a change with children walking or biking to school, but we have done community surveys, and we have seen an increase in the adults that are walking and or biking in the community. So the increase in biking itself has risen from 19% to 25%. So we have seen an increase in the adult population in our target audience, which is awesome.
Excellent. It looks like there's one more question. And that is, have you been successful in changing the environment so it's safer to walk and bike?
Yes, we have. Outside of the high school, that's one of the first pictures I showed you. The city just recently installed a mini roundabout at that intersection, and to help calm traffic and make it easier for students to walk and or bike to school. So the city has been working on making more changes to the community. It's just those particular changes do take quite a while, but it's important to bring attention to those. And I think the social marketing campaign has really helped bring attention to some of those locations.
Excellent. Thanks, Cindy. I think that's all we had for questions. So thank you everyone for joining us. You can get more information about the Rural Health Transformation Center and access all of our tools and resources via the first URL link that I posted into the chat pod. If you're interested in our work and would like to receive more information, or if you have questions, feel free to email us at populationhealth@mhif.org. Thank you again and have a great day.